Good morning and welcome back to UCI Mind's monthly Facebook Live series, Ask the Doc, Alzheimer's Research Today. First, I just want to give a shout out to Kirsten Klein. Happy birthday. Kirsten Klein's our education coordinator and works behind the scenes, making sure all of this runs smoothly. This is episode 6 of our monthly series. And today, I'm very excited to be joined by Dr. Steven Tam. Welcome, Dr. Tam.
Thank you for having me.
Yeah, and I'm Chelsea Cox. I'm your host for this series and the Associate Director of Education for UCI MIND, which is one of 32 congressionally designated Alzheimer's disease research centers across the country, and the only center right here in Orange County. We are a collection of about 100 faculty like Dr. Tam, staff like myself and Kirsten, and students who have really dedicated their lives to solving Alzheimer's disease and related dementias. And in this Facebook Live series, our aim is to bring the experts to you to answer your questions about the latest advances in Alzheimer's research. Dr. Tam, who is joining me today, is a board-certified geriatrician specializing in geriatric neurology. And he currently leads 2 Alzheimer's disease clinical trials at UCI MIND. So hopefully he'll tell us a little bit more about those today. Dr. Tam received his medical degree from University of California, San Diego, and he's been recognized by the Orange County Medical Association as a physician of excellence for the past 5 years. So it's really a pleasure to have Dr. Tam with us today to answer questions from you, the viewers, about medications and treatments for Alzheimer's disease. Now, and thank you to our viewers for attending live today. And if this is your first time attending, the way that this series works is I'll get things warmed up. I'll start by asking Dr. Tam a few questions. And then as your questions come up, please go ahead and type them there in the comments box. And I will read the questions out loud, and Dr. Tam will answer as many questions as he has time to. And please do remember that whatever you write down in the comments box will be linked to your name and visible to others. Okay, so to get started, Dr. Tam, first, could you tell our viewers what current medications are approved for the treatment of Alzheimer's disease and how they work to help patients?
Sure. Happy birthday, Kirsten, also. But currently, FDA has approved 2 types of medications for the treatment of Alzheimer's disease. One type is a cholinesterase inhibitor that includes Exelon, Aricept, and so they're one class of medication. The other one is Namenda memantine, and then you also have some combination of the medications as well. So those are the 2 that are currently available. And what they do is that when we look at the studies that are out there for Alzheimer's disease, it's anywhere from mild, moderate to severe dementia, severe Alzheimer's. They help with what we see on neuropsychological testing, cognitive testing for patients with dementia. And they help with a few points on the testing. And for some, that may translate to some improvement in everyday activities. For others, it may not be that big of a change that are there. Okay.
Do any of these medications slow the progression of the disease or prevent the disease?
As far as we know from the different studies, they don't actually change the overall course in terms of modification. So Alzheimer's and dementias and the different dementias that are out there, Alzheimer's is a type of neurodegenerative dementia. So that means that essentially the neurons, the tissue, there's a component of degenerative change to it. From what we see from these medications, we're not actually seeing reversal of that. And so when we say that it doesn't reverse the course of the disease, but rather that it actually helps with some of the symptoms in terms of some of the testing.
Okay. I see that we already have a question here. And if you I see a few more people have trickled in. So just as a reminder, if you have questions, you can go ahead and type them in the comments box and we will answer them. So from one of our viewers, the question is, can cholesterol lowering drugs such as statins worsen the cognitive function of Alzheimer's patients?
Yeah, the statin medications have been a particular interest for a while now. And I think the answer is that we probably don't know exactly whether or not it worsens or improves. It's been interested in, it's been looked at. There have been studies that are done looking at whether or not it actually improves cognitive function in the brain in people that have dementia. So, and those really haven't panned out. So a lot of mixed findings between the two. So we don't know for certain. And I think the issue with the cholesterol-lowering medications is that if there's a significant reason to be taking that medication because you have heart disease or stroke and you need to lower your cholesterol, that might be more worth it to be taking that medication rather than say that you're trying to prevent a dementia. And at the same token, too, we don't know that it significantly worsens it, that would outweigh the benefit you're getting from trying to lower your cholesterol at this time.
Mm-hmm. So in general, if a patient presents with high cholesterol to your clinic, what is the course of action?
Yeah, I mean, I think it becomes a question of, okay, if they have high cholesterol, you try to weigh out what those risks are going to be in terms of, how is this going to impact you in terms of heart disease or neurovascular disease or the risk for stroke that are there. And if there's a significant risk, it might be more worth it to take it than to say that there's a significant cognitive function or impairment that we know of from it.
Okay, looks like we have a few more questions here. One of the viewers made a statement that drugs seem to be the same for the last 20 years. Why isn't there more progress in the last 20 years?
Yeah, I mean, that's a challenging it's a challenging area because we're trying with all the different medications in the clinical trials to figure out what are the options. It's not to say that drugs haven't been tested to see if it improves cognitive function or trying to prevent the disease from worsening. It's just that there just really hasn't been successful progress in making it. That being said, we've learned a lot from all that in terms of the different trials that have gone on, in terms of what targets to be going after with that. Okay.
Yeah, lots of progress has been made over the past 20 years. And are you able to tell us about any promising or current clinical trials that are showing promise for Alzheimer's?
So a lot of the trials and the medications that have been looked at have included everything from targeting the amyloid plaques and the tau tangles that you hear about, to other things like growth factors for the brain, to vaccinations and trying to prevent the disease. And so, the studies that are out there are going after all those different targets. And that's because of, the different studies that have been done. They've shown us, okay, what's been successful and what's not been successful. We just aren't there yet really with it.
Here's another question. Which type of medication would you recommend for a 71-year-old woman just diagnosed with Alzheimer's whose main issues are speech issues at this time, whose mom also had Alzheimer's, and what do you recommend for family members?
So I mean, I think just as a disclaimer, it's something that you do need to talk over with your physician to see if any medication is appropriate or not. Given medications all have side effects and potential other adverse risk on there, so it is something to go over. But in somebody who has been formally diagnosed with Alzheimer's disease, speech can be one of the presenting symptoms, speech issues. And usually, again, the medications that we usually start with to see if it can help is something from the cholinesterase inhibitor class to see if there is any improvement in there. And again, the big thing is to watch out for any potential side effects and something to go over and monitor carefully with your physician. As far as the question goes regarding family members, at this time, I think the genetics aren't still completely understood related to the disease, and that's a whole nother topic, a whole nother Facebook Live, I guess, for discussion. There are some genetics that we know that are where people will have very dominant genes that are causing the disease, but usually this is when people are getting it in their 40s in these families, and pretty much all siblings will have it at the time. If it's later on in life, the genetics, we're starting to identify some of the smaller components to it, but it's still not completely understood. And so given that age is usually the biggest risk factor for Alzheimer's disease and dementia in general, I mean, when you get to that age, you're going to carry that risk that's there. So biggest thing that we have for folks in terms of just prevention type strategies is really keeping active as much as possible. And we can get to that later on.
Okay. Just as a reminder, as you're typing in questions, Dr. Tam won't be able to answer very personal questions about personal conditions and experiences because he doesn't have the background in to be able to answer those. So please try to keep your questions as general as you can. Now, another question here are, what are your thoughts regarding cancer treatments presenting memory issues that don't improve after a period of time? Do you feel that those types of treatments have any effect?
Yeah, that's somewhat of a complicated treatment because, you know, having some form of a cancer in itself obviously will have a significant impact on your health, right? When you have a chemotherapy for treating a cancer, there can be significant or profound side effects, you know, throughout. And so potentially you're affecting a lot of different body systems, organ systems, and by affecting those organ systems in the body, you can cause cognitive dysfunction as well, potentially, you know. So it's pretty loaded in terms of, okay, how much is that actually going to worsen memory versus contribute to the risk for developing Alzheimer's and dementia. So that's fairly complex. I mean, I think you have to, again, like the other question regarding statins, it's a matter of weighing out, okay, you know, how much is the benefit of treating a cancer versus that risk of having some potential cognitive dysfunction. And I think that it reflects probably medicine in general, is that when we, you know, are trying to treat one thing, there always is a potential risk or harm for causing some other thing. It's just a matter of, okay, what's that, how much do you weigh that benefit of treating a cancer, treating diabetes, treating a cholesterol problem,
yeah.
You know? So it is something to think about. That's probably what we have for that right now.
Okay. Another question here, is there an age when doctors will no longer use medication to try to help with memory impairment and possible Alzheimer's, like after the age of 85?
The current FDA-approved medications for Alzheimer's don't really have an age cutoff on there, so that is one thing to keep in mind. The biggest hindrances, I think, are going to be tolerance of the medications. Then there's also that component of whether or not you're actually getting a benefit from the medication and how long do you go with treating the medication. And again, that's another thing that is probably going to be a little bit more personal, something to work with your physician on. Say you start a medication like Aricept, you might trial it for 6 months or a year, see if there is a benefit or not. Again, you start off with these medications and you monitor closely for side effects, intolerance issues, and if a person can't tolerate it, again, it might not be worth that risk of taking that medication. So there's no exact age cutoff. It really becomes more of a tolerance issue, of an issue of how long to take that medication for.
Okay. And these medications that are approved for Alzheimer's disease, is there any benefit of these medications in people with mild cognitive impairment or other causes of dementia? And you know, what kind of medications are prescribed for people with those other causes?
So Alzheimer's is just one form of dementia. There's many other forms of dementia that are out there. You mentioned mild cognitive impairment, which is in many ways what folks think of as having a memory or cognitive issue that we can identify, but people aren't affected by it functionally, that it's not impairing your everyday life, affecting your ability to do everyday things. The medications that are out there that are approved for Alzheimer's disease, we don't have, they haven't shown to be beneficial in mild cognitive impairment per se. Some people will use it off-label use for it and might get some benefit in terms of, again, the symptoms from it. We don't have any substantial evidence that it's going to prevent it from getting worse. Like I was explaining earlier, that it doesn't change the overall neurodegenerative course of Alzheimer's disease. So that's how we look at it from mild cognitive impairment. So some people will have bad enough memory symptoms that they will try it off-label to use, but whether or not it's actually going to prevent the disease or help things later on, we just don't know. And again, that's why it's off-label use for that. It's shown some benefit in some other dementias out there, including vascular dementia and Lewy body dementia. So there is some off-label use for some of these other dementias that are out there. And I think for the most part, majority of the dementias otherwise, the vascular dementia, the Lewy body dementias, the frontal temporal dementias that are out there, we often use other symptomatic type treatment for it. Okay. Different components. I think there was another question up a little bit higher. Try to capture that.
So this question is about studying sleep apnea and its potential association with Alzheimer's disease dementia, and that it seems to be a relatively ignored cause of these diseases. So any comments about that?
Yeah. So some of the other components for treating dementia, or memory in general. I think that we are very interested in looking at the impact of sleep and memory impairment and the treatment of dementia. We all know that if you don't get a good night's sleep and you have a test the next day, or you're trying to do something at work the next day, your performance probably isn't that good. So that by getting enough sleep, getting enough rest, you're performing better, you have better cognitive performance. People with sleep apnea potentially, or other sleeping disorders that are out there, there might be more of a prolonged impact. And that is something of interest to some researchers. I think we just aren't there that we have that information yet. And I think there are some preliminary studies looking at the impact of sleep and on memory loss and any neurodegeneration that's out there.
Yeah, and I'll just add, Doctors Ruth Banka and Bryce Mander are two faculty members of UCI MIND that are looking very closely at the link between sleep and Alzheimer's disease and other forms of dementia. And actually, the very first episode of this Facebook Live series was with Dr. Bryce Mander. So if you missed that and you want to learn more about this important link, you can go to our YouTube channel, UCI MIND's YouTube channel, to view that.
Yeah, and actually I'll add to that. They are very interested in it, and I think generally speaking, like if you go to your clinician and you tell them about your memory concerns, one of the questions that typically will come up is, how are you sleeping? We know that, again, if you're sleep deprived or have other sleep issues, that there is some impact there, and clinically we would probably try to get you to figure out, okay, what is the cause of that sleep problem, or have you see a sleep specialist if that's the case.
And UCI just opened last fall a brand new sleep center to be able to see patients who are having sleep problems, and also to be able to conduct research studies on sleep disorders. And the best way to really get involved and to learn about the different research studies that are happening at UCI is to register for the UC Irvine Consent to Contact Registry at c2c.uci.edu, which Kirsten will post here. A few more questions here. Now, these next couple of questions are related to supplements. Yeah, so one is asking about vitamin B3, niacin, and being studied in mice. Is the related substance nicotinamide also, or am I saying that right? Niacinamide? Niacinamide also applicable.
And then
there's a question about turmeric. So what about these different types of supplements and their potential to prevent or to help symptoms of Alzheimer's disease?
Yeah, so I think there's a lot of questions that typically come up regarding different supplements, vitamins that are out there. Niacin, B12, folate, turmeric, different items that are just available and touted as having some memory benefits. And, to date, we just don't have substantial evidence that any of these components or these supplements or vitamins are actually doing the job of preventing Alzheimer's disease and dementia. That being said, I mean, there are some certain cases where you might be low in a B12 level, or a B12, vitamin B12 per se, where there might be some benefit there. So again, these are all things to be checking on to see, what levels you're at. We just haven't seen it for any of these items, whether or not, if you supplement it extensively, whether or not there's a significant benefit. I will say that some of these substances, we have seen, some changes that occur in the lab level, like nicotinamide, which is one study that's being done right now. And, we see changes potentially in the tau tangles and cognitive performance in animal models. And so, these are of interest, and we try to translate these to as much as possible. So, for example, here at UCI, one of the studies does involve nicotinamide, and we're looking to see, how this might change cognitive performance in preventing memory loss from that sense in that study.
Okay. There's a question asking if there's any current studies. I think this was the question related
to the supplements.
Okay, yeah, whether there's any current studies. Again, the best way to learn about new studies and whether you might qualify, you can register for UC Irvine's Consent to Contact Registry. Also, if you're more interested in looking at a current list of clinical trials at UCI MIND, I believe they're listed on the UCI Health website. Another question here that was received from a community member is, what have been the more promising research study results leaning toward a cure vaccine, which I do think that we addressed earlier in the episode, but if you have any additional comments on that.
Yeah, I mean, I think it goes back to like what we were saying earlier. Yeah, I mean, the targets have been going over the amyloid plaques, the tangles. I mean, the different study results. Again, you've got positives and negatives, and I think some of that was addressed at an earlier Facebook episode. But it really is. It's still going after some of those targets. Going after the plaques, the tangles, and really maybe even combining the two. In terms of the different therapies.
Okay. Let's see here. Now, we talked a little bit about supplements. Is there the potential for supplements or medications to actually increase the risk of cognitive problems or Alzheimer's disease?
Well, I mean, again, so I think the big thing with any medication or supplement is to look at, okay, what are the potential adverse effects of it is what's being asked here. And we know that, some medications that are potentially going to worsen memory function. Let's say you take a sleeping medication per se, right? Sometimes that may make you too sleepy, and that can worsen cognitive function. There's the issue or question that comes up often with a medication like diphenhydramine or Benadryl. And that we know can cause cognitive dysfunction or delirium out there. There's a warning that, you're not supposed to operate heavy machinery if you take this medication, right? Because in part, it can make you have some confusion potentially. And when somebody has already some cognitive impairment, brain impairment, then you want to be careful how you're using that medication. We don't know exactly what the risks for whether or not it actually causes the neurodegenerative component that we see in Alzheimer's disease. But we do know that because of the chemical effects of it and the brain chemistry, it can affect that and then cause the cognitive dysfunction. So there are medications out there. Again, always ask your doctor whether or not it's safe to take. Likewise with any supplements. Some supplements that are out there can cause the same cognitive dysfunction. So it's just something to be aware of when you're taking anything new. Make sure you let your doctor know. I think that's probably the most important thing.
Okay. Another question here is asking how you feel about the use of CBD oil And then maybe after commenting on that, you could talk a little bit about non-pharmacologic interventions that might help a person with Alzheimer's disease or memory problems.
Yeah, I think so. The use of CBD oil, I think it goes along with the others. We don't know enough about it quite yet, and I think it's an interest for some in terms of what effects it might have on dementia, Alzheimer's disease itself, on what effects it might have on the symptoms that are related to Alzheimer's disease, behavioral changes, mood changes, all those different things. But like the other supplements, I think we just don't have enough substantial evidence where we would tell everybody to be taking it if it was beneficial. So a lot more still needs to be learned with that. That being said, you were asking about other preventative measures that might be beneficial. Again, a lot that we have to go off of are different epidemiological studies. Most of them point at different lifestyle benefits that seem to lower the risk for getting dementia in different populations and people that take on different lifestyle measures. A lot of what we have just really points to making sure that you have a good, healthy diet, oftentimes modeled after a Mediterranean type diet, that you stay physically active, get exercise, both for many health reasons, but also for the cognitive piece. It seems to lower the risk for developing a dementia. We actually have an exercise trial going on right now that is looking to see if we can prevent that development in people that are exercising regularly, and also people that are staying engaged cognitively, staying cognitively active. And so usually it's a matter of, when you're doing activities, think about how active those activities are, how engaged you are when you're doing those activities. So for instance, if you're watching TV and you're watching an episode, a lot of times there's very passive behavior related to it, right? We are absorbing, we're just getting that information in, whereas we might not necessarily talk about what happened on that episode of whichever TV show or what happened on the news. But oftentimes, if you're able to discuss with others and you help reinforce some of that information. And so we try to encourage people to be doing activities that keep their brain active, cognitively active as much as possible.
Okay. It looks like we have time for about one more question, and there is a question from a viewer here asking, other than blood tests for issues like like vitamin deficiencies, do you feel that there are any worthwhile tests to check for the risk for Alzheimer's disease?
So I think there was a prior Facebook episode that addressed different blood tests and different.
The last episode did talk about blood tests. Yes.
And so the typical workup, we'll look for different deficiencies that are there when you're presenting to your clinician. I think that is a very big area of interest. We call them biomarkers to figure out, okay, to have better tests to be able to tell us whether or not you have the disease or what your risks for developing that disease are potentially. And so that is a big area of interest that are being worked out. We're still not quite there yet with it, but that is a very hot area of interest.
And then if you're interested in this topic of testing and risk testing for Alzheimer's disease, our next episode of this Facebook Live series next month on August 2nd at 9 o'clock in the morning is going to be with Dr. Craig Stark. And he's going to be talking about what brain scans are available to really look at risk for Alzheimer's disease. So if you'd like to learn more about that topic, please do plan to attend and put that in your calendar. And that's all the time that we have for today. So Dr. Tam, I just want to thank you so much again for joining us. It was a pleasure to have you on our episode and to answer all these really great questions about treatments and preventions for Alzheimer's disease. And thanks very much again to the viewers for attending live and asking your excellent questions. And if you want to learn more about Dr. Steve Tam and his research or UCI Mind in general, you can visit our website at mind.uci.edu. conference.mind.uci.edu. I mentioned the UCI Consent to Contact Registry, which the link is here in the comments box. And then lastly, I just want to announce that UCI MIND and Alzheimer's Orange County are going to be hosting their 30th annual Southern California Alzheimer's Disease Research Conference on October 25th of this year, so in Irvine. So please save the date and plan to attend us in person at that conference. And thank you so much again for attending, and we look forward to seeing you next month. Bye.
Thank you.